Yes, in our book we are focusing on benchmarking, international benchmarking, and benchmarking is an industry-proven tool in order to get better decisions for the management in hospitals. But if you traditionally focus on benchmarking in terms of figures, there is a big danger to be misleaded, and therefore we focused on best practice management. That means we have a look to best-in-class hospitals, and there we identify best practices pertaining nursing organization, pertaining logistics, pertaining purchasing management, and so on. And I think the highest level of competency you can reach if you have a comparison on best practice management based on the outcomes of other industries. If you compare, for example, the results of the automotive industry in terms of logistics, and you turn it over to the area of hospitals, then you can learn a lot, and you can achieve leapfrog results in your own area, in your own organization of your own hospital. And this, I think, is what we would like to address with this book to our readers.
Well, the idea of actually going for this, the special call, International Best Practices in Healthcare Management, came about following several years in which Wilfried and I have been involved at the EHMA meeting, actually, where Wilfried chairs the Special Interest Group on benchmarking and international best practices. And the opportunity came to link up with colleagues from the United States, colleagues from Australia, New Zealand, Asia, South America, whatever, I mean from every country. And the idea is that when we're talking about healthcare management, there are so many lessons to be learned. And indeed, we kept the call quite open to deal with various areas, be it people management, be it operations management, performance management, health literacy, how to get it right as regards metrics. All these are important to us. And as Wilfried said, the international comparative stance of it is exciting, isn't it? Because first of all, it's very difficult to do international comparative research, and therefore that was challenging. Additionally, in the book we have invited well-known scholars, basically giants, as we call them, in healthcare management, who would be providing us commentaries that would tie very much to the articles that we have received for the volume. And as a whole, the volume, with the commentaries together with the articles, should provide an exciting and a roadmap for more in the future. We need more in the future, international comparative research. And I think we want that little bit to stimulate the researchers out there of the need of this.
And I think there is another interesting aspect that is crucial for our readers. When we talk about best practice management, then there is an interrelationship between a problem and a solution. And you also get hints pertaining how to manage the change. And this, I think, is very important for the readers. They can identify with the problem area, they can take off a solution that works, and they get information about how to organize the change management. And this is most valuable for the readers to get these information in order to make, let's say, at the end of the day, a better job for the hospital.